Can I have puffy eyes and hollowness at the same time?
We see a lot of people in our office concerned about puffy eye bags and hollow under eyes. While they may appear to be opposite situations, there are certain circumstances where they can exist concurrently. I'll discuss how I assess patients with concerns like these in the eye area and how I develop treatment solutions for them. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As a cosmetic oculoplastic surgeon, I specialize in primary upper and lower eyelid cosmetic surgery, non-surgical eyelid treatments including the application of injectable fillers, neuromodulators, and lasers, as well as the correcting of complications of eyelid surgery originally performed by other doctors. Helping people with puffy eye bags is something I do every day, along with treating hollow eyes and discoloration of the lower eyelids. A common concern for patients who come to me after having their under-eye bags addressed elsewhere is a perception of lacking volume under their eyes, often referred to as appearing hollow. Paradoxically, we often see patients who have had treatment for hollowness by another doctor and come to see me because they find themselves with eye bags. There are several different conditions where you can have both puffy eye bags and hollowness present simultaneously. The most common of which is when the elevation of under-eye bags make the lower eyelid look relatively hollow. This is like a mountain next to a valley. In such cases, people often only notice hollowness, not realizing it's the eye bags that are making their eyes look relatively hollow. In these cases, reduction and sculpting of the fat that causes the eye bags can have a significant improvement in the patient's perception of a hollow look. When I treat under-eye bags surgically, I sculpt the fat to create a natural look with the goal of having you look like you never had eye bags. I perform this type of lower eyelid surgery using a method called transconjunctival blepharoplasty, as opposed to the more common transcutaneous blepharoplasty. During transconjunctival blepharoplasty, the fat pockets responsible for the eye bags are assessed from behind the eyelid, so no external or outside incisions are made in the lower eyelid. From the way I perform this technique, my patients are able to see themselves afterwards with a more natural appearance, like they never had eye bags. I also am able to avoid common complications associated with an external incision. It's often seen in people who have undergone the outside incision or transcutaneous method to access the fat pockets to find the delicate lower eyelid support structures are compromised and the eyelids become pulled down, leading to a rounded look. Many doctors often combine the transcutaneous method with skin removal to try to treat wrinkles, which only contributes to more rounding due to the eyelid skin being a deficit or shortage. In my practice, when my patients want to improve the appearance of wrinkles under the eyes, I generally don't remove skin, but rather I improve the eyelid skin quality with non-surgical treatments. I use platelet-rich plasma or PRP to thicken the skin, improve texture, and stimulate collagen, as well as using laser treatment to improve the superficial and deeper layers of the skin. There are times when the fat pockets are so large that the underlying hollowness in the tear trough and cheek are hidden. Although some doctors advocate procedures such as fat transposition into the tear trough, I generally feel these procedures to be imprecise and minimally predictable. I counsel my patients to understand that after the under-eye bags are addressed, volume enhancement of the tear trough and cheek can be performed safely and predictably with hyaluronic acid fillers. Another scenario is when there is significantly puffy eye bags and at the same time there is a lack of cheekbone projection. This is typically seen with facial aging. As we age, there is a progressive loss of bone, muscle, and fat in the face. For volume correction on the cheekbones, I approach this area a little differently than most doctors. I use a technique called structural volumizing, where the filler is placed at the bone level, below the muscle layer. When placed in this space, the filler is much more stable and provides the cheeks with solid structure and definition, creating a natural, youthful appearance. I use longer-lasting fillers such as Juvederm Ultra Plus or Juvederm Voluma. It's common with more traditional filler methods to place filler in the cheeks right under the skin for the filler to migrate and look soft and doughy. When treating puffiness under the eyes as well as hollowing, it's important to also look at the whole face. I often tell my patients that the whole is greater than the sum of its parts. Addressing puffiness and addressing areas of relative hollowness gives the face a more balanced, refreshed, and youthful appearance. I hope you found this information helpful. Thank you for your question.